Welcome. It is now official. The Union government has fixed the price of vaccines administered at private hospitals at 250 rupees for a dose for those above 60 years of age and those above 45 with comorbidities starting from the 1st of March. So the vaccines administered at government hospitals will be free of cost. So starting Monday, remember, India's COVID vaccination drive will open up for those above 60 and for those above 45 with comorbidities. This at both government and private hospitals, and in a major policy move, the centre has scaled up the participation of the private sector. Now, after healthcare and frontline workers, the third phase of vaccination against COVID-19 is unrolling to cover 27 crore people at thousands of government and private vaccination centres. This even as cases across India are on the rise. Several states are showing a resurgence. 6 states, Maharashtra, Kerala, Punjab, Karnataka, Tamil Nadu and Gujarat have shown a surge in new cases in the last 24 hours. And after cases receding to the lowest levels, the discovery of mutated variants announced by the government on Tuesday just further complicates matters. So, are we now facing a moving target? Are we now in a race against time for India to build up immunity amongst our population faster than the virus can spread? And if so, under these circumstances, what do you need to know to protect yourselves, to protect your loved ones? To answer those questions, joining us on the show, Dr. Guleria of the All India Institute of Medical Sciences. Thank you, Dr. Guleria, for your time again. We had a significant decision this week, a critical opening up of the vaccination drive with the rollout for the general public being moved up, I think, from what was previously estimated a window of mid-March. But it comes at a time, Dr. Guleria, when India could be possibly on the brink of a second wave of infection. So is this apt, timely, rapid ramping up of the campaign a response to that, the latter?
In a way it is, because as we are seeing, there is a cause of concern, because as you rightly said, there are 6 states where there has been an increase in number of cases. And if you look at how we were about 15 days ago, when our cases were actually quite low, around 10,000 or less, we've gradually started having an increasing number of cases. And that is something that we need to prevent. Besides the measures that we're already taking, one other strategy that we have placed in is vaccination. And if we are able to vaccinate a large number of people, we would be able to not only bring down our cases, but in those who are more susceptible, bring down the hospitalization and the death rate. So I think this is something that needs to be done, and that's why it's being done as early as possible. And I think this is something that is really required.
And how does this affect the vaccination drive then? This phase coming, taking place amidst a rise in cases. You have this vaccination drive hitting 5th gear, set to gain new momentum. Is it at risk then because of this disruptive new wave of cases?
I don't think it's at risk. I don't think it's disruptive. I think it will be something which may help in actually bringing down the cases, and therefore we must have an aggressive vaccination drive in states where the cases are increasing.
And is that why?
If you just look at what UK did, UK was able to really vaccinate a large number of people, and there is now data emerging that even just giving one dose really helped in bringing down the number of cases and decreasing the mortality.
Correct. And so the involvement of private players, is that, that's a welcome move or an obvious move required to help accelerate the rollout? Correct.
As was what we needed when we started having testing. You remember, testing was first being done only in government facilities. Yes. But when there was an increasing need, what the government did was it capped the price, but allowed the private labs also to do the testing. So in a similar manner, the vaccine is being rolled out. It's being made sure that it's done in a judicious manner, and those who really need to be vaccinated are vaccinated. It's not misused. At the same time, the cost has been sort of capped so that it's affordable, and it's not something that is actually done to make a huge profit.
And a logistical question, Dr. Guleria, because as cases rise in Maharashtra, that's the state with the highest number of cases, lockdown is being extended by 1 week in Amravati. What happens to the vaccination drive there? Those above 60 and 45 with comorbidities go ahead for their vaccines?
So a strategy will have to be developed, because as we go ahead and do the vaccination, we need to make sure that the vaccinating site is not crowded. We need to have physical distancing, masks being maintained, and some sort of a staggering being done so that the vaccination site doesn't become a super spreading event. So it has to be done in a proper manner, but it's something that needs to be done, because if you are able to vaccinate more and more people, especially in areas where cases are rising, we will be able to create some sort of an immunity in the general public, which will in turn prevent the spread of cases and break the chain of transmission.
But the vaccine doesn't start having an effect immediately.
Correct. So that's why the earlier we do it, the better it is, because if we start vaccinating from the first, it will take some time for the vaccine to really to produce the antibodies that we need, and we will also need a second dose, and after that we will have sufficient antibodies, although the first dose will also be helpful. And that is why the earlier we start, the better it is, rather than delaying it too much.
Dr. Guleria, there's the irony is that we vaccinated over 1 crore people faster than any country other than the US. But the fact is still that we're inoculating less than 2 lakh people a day, and that's not really going to allow India to reach the target of 30 crore by July, right? So far, according to statistics, we've immunized only 1% of our population. Israel, for example, has immunized 85, the US in the mid 25 to 30. So from the first, that is from Monday, how many vaccination sessions is the government planning or hoping to get per day? Currently we're, about I think 10 to 11,000.
Correct. So I think you're very right that if you look at the number of people who are vaccinated, it's large. But if you look at it in a percentage basis, it's very low because of the population of our country. And therefore, we have to look at a strategy where we can increase it exponentially. And I think that is what is going to happen if we start opening out to the private sector. We have to balance out two things. One is having enough vaccination sites and being able to develop a cold chain facility that all these sites get the doses that they need and the vaccine is available to them. Secondly, we should make sure that the supply is there. It should not be that you really vaccinate a large number of people and you run out of the vaccine and you don't have the second dose available. So that balance has to be maintained in terms of the supply chain, in terms of the cold chain being maintained, and in all the sites that have been opened up, being able to give the vaccine to the people who need to be vaccinated. It's a huge task. But I think we've learned from the last few weeks, and I'm hopeful that we could really ramp it up in the next few days.
Such a complicated, mammoth exercise really to vaccinate our entire population. But Dr. Guleria, now that the vaccine is available in private hospitals, can one choose which vaccine they would want to take?
So logistically, it's going to be difficult that we have different or 2 vaccines, or maybe a few weeks from now, we may have 3 or 4 vaccines. No. You can't have all of them available in all these centers. So you will have one center being giving only one vaccine, and that will also be as far as the second dose is concerned. But it's likely that in your area, you may have more than one vaccine being provided in different private hospitals. And therefore, it may indirectly give you some choice, because you would know which vaccine is being given at which center. But you can't really go to a vaccination site and ask for one vaccine or the other. That will be for that center itself, because otherwise it will create a lot of logistic problems and confusion.
Sure. But as you point out, we do have the luxury, the advantage of a lot of vaccines. In that context, do you think the public should have an option of being able to pick for themselves which vaccine they would like to take, push for possibly even Pfizer that has shown an interest in entering India, Moderna? Some point out that is the system possibly, highly controlled, centralized, regulated, or is that what's required? As you point out, it's such a mammoth, complicated, large exercise.
So there are two things. One is any vaccine which comes to India has to get the regulatory approval, whether it be Pfizer, Moderna, or any of the newer vaccines which are coming, the Johnson & Johnson. So once they have the approval, then the strategy needs to be developed as how do we roll it out as part of the government program. Secondly, it will depend on the balance that we have between the supply and the demand. If we reach a situation where the supply and demand match each other, or the supply is more than the demand, then it's easier for people to choose. You could really buy a vaccine off the shelf, as we can do for the influenza vaccine. But on the other hand, currently, since the demand is much more than the supply, remember, even if you go by phase 1, which is 30 crore people, that means we need 60 crore doses. We need 2 doses. Yeah. And that itself is a huge number. It's more than the population of many countries or most countries in the world. And therefore it's a huge task, and it will become more complicated if we start having a pick and choose policy.
In that context, Doctor, there's a growing global opinion, including the WHO, that says now that an 8 to 12 week break between doses might actually be better from an immunity perspective. Does that affect India's program and the targets? Does this serve our requirements, give us more luxury of time administering the first dose to all, or does it, challenge, is there a challenge to have different vaccines that have different requirements?
So that data is emerging, but we need more data as to whether we can delay the second dose and thereby give the body some more time to develop a better immune response. Some data is there for some of the vaccines, but we need more data, and especially considering that we will have more than one vaccines, it will become logistically a problem if we say that for one vaccine you can delay it by, let's say, 12 weeks and for the other you can't delay it by 12 weeks. That will become a big challenge, and therefore logistically for rolling it out, it may be a problem unless we have data which says that for all vaccines, you could delay it by 6 weeks or 8 weeks. Then it's something that can be done. And for that, we need actually more data. It's better that we stick with what was done and the trials which showed the efficacy rather than playing around with it. It was done in the UK to begin with, not based on the data, but based on the fact that they wanted to vaccinate a large number of people because of the huge surge in the number of cases that happened in the southern part of England.
Now, Dr. Guleria, as a doctor, I want to ask you this question. From Monday onwards, anyone over 60, above 45, which means all our parents can go and get themselves vaccinated. But for that, you need to download an Arogya Setu app. You need to register under the Covid app. You have to register, book an appointment for vaccination. Is this, as a doctor, you think too tech savvy for a country possibly on the brink of a second wave? We're in digital India, but right now time is of essence. How does one balance the two?
So this is going to be a challenge, and I think there are solutions for this. The first issue is you need to balance it out in a manner that for that given day you have the number of doses available matches the number of people who come for vaccination. It will create chaos if you have, let's say, double the number of people who come for vaccination as compared to the number of doses available there. It will really create a lot of problem at the vaccination site.
So you need to have some way of registering, you're saying? Exactly.
You need to have some way of registering because the doses have to match the number of people who come there. If you open it out and say you can just come like that, it will create a problem. But accepting the fact that there will be some people who are not tech savvy, you could still go to the vaccination site with your iCard, with your Aadhaar card and register there. Your data will be uploaded. If by chance there is a vacancy available, you could still have a walk-in and get your vaccination on that day. But if there is no vacancy, you could book your appointment there only and come back when there is a vacancy available. So even if you're not tech savvy, you can visit the nearest vaccination site, which will be displayed and which you will come to know from the local authorities. You can go and register yourself there and you may be lucky and you get the vaccine on the same day.
All right. So what you're saying is walk-ins are technically possible too. All right. Dr. Guleria, we have to take a break. In today's format of the show, unfortunately, we have to. We'll come back on the other side with more questions for you. Thank you. Welcome back. We're at a big milestone for India's nationwide vaccination program, which is expected to hit fifth gear starting Monday when it opens up to the public. We have with us Dr. Randeep Guleria. Dr. Guleria, before I focus on the India example again, I want to just bring you, get your opinion on the big international headline this week. The US expert panel recommending authorizing Johnson & Johnson's COVID vaccine. Could that be a game changer? Because we're talking about globally, and this is not the vaccination program could take a year globally.
Correct. So the more vaccines we have, the better it is. And Johnson & Johnson has the advantage that it's a single jab vaccine. Yes. You need only one shot of the vaccine, and therefore it makes it more practical. It's also easier to store and transport, unlike the Pfizer vaccine. Therefore, I think this is also going to be something which will be very useful. And as I've said, the more vaccines we have, the better it will be, because if you look at the global population, the number of people we need to vaccinate globally is huge. And the pandemic is not going to be over unless we're able to really have a robust global vaccination program. Regional vaccination program will not really control the pandemic because people travel, the virus will move with people, and if you are not able to control it in one area, you will have more viral replication in that area, which will lead to emergence of more variants. So therefore, it is an international issue rather than a national issue, and that's why more vaccines will really mean a big thing for the global community as far as controlling the pandemic is concerned.
All right. And I want to again come back to the fact that starting Monday, our vaccines are going to be available to the public. For anyone above 60, for anyone above 45 who has a comorbidity, they can go to a hospital after registering, both a government hospital or a private hospital, and get themselves vaccinated. Dr. Guleria, what would your advice be to our viewers right now, deciding about whether or not they should take that vaccine, when they should, how they should?
My advice would be that everyone who fits into the criteria, that is if you're over 60 years of age, with or without comorbidities, or more than 45 years of age with comorbidities, you must register and get your vaccination as early as possible. It's not only for yourself, but for family and as a social responsibility. We're looking at 2 or 3 things. One is to protect yourself so that you don't get severe illness, you don't land up in a hospital or an ICU. Also to protect spreading the disease to your near and dear ones, and also breaking the chain of transmission, because the more the number of people whom we are able to vaccinate, the lesser the number of cases, and the lesser the number of cases, the lesser the chance of viral replication happening and thereby leading to more variants. So everything is linked to more and more people getting vaccinated, along with, of course, following COVID appropriate behavior.
And there should be no hesitancy in anybody's mind, simply because 1 crore Indians have taken the vaccine and we've not reported any deaths, as far as I know, no serious side effects. That is huge. That means we have this confidence behind us and we can now move rapidly forward. Is that correct?
Totally. I think we must really understand that more than 1 crore people have been vaccinated. There was a time that people said that this data is not sufficient for safety, or the fact that this vaccine has been tried outside India mainly. Trials have been done outside India. Less people have been vaccinated in India as far as the Serum Institute vaccine was concerned. But now we have a huge number of people who have been vaccinated. We have a lot of robust data which suggests these vaccines are safe. They are really not causing any significant side effects. And a large number of people who are elderly and who have comorbidities, who are healthcare workers, who are frontline workers, have also been vaccinated. So I think there is a lot of confidence, and therefore people should not really go into this issue of what social media is saying. Get over this vaccine hesitancy and come forward and get themselves vaccinated as early as possible. It will really save your lives. This is all I can say.
So we really are the world's largest human trial for these vaccines. But given that, we can now actually shift into 5th gear. Dr. Guleria, there has been some criticism about the path chosen by India, going slow in the first stage. Now we're starting to pick up. But in a sense, I've been thinking about this, and the logic really could have been that first you need to protect and vaccinate the healthcare workers who then have to administer this vaccine to the Aam Aadmi as we open up in this. And I'm expecting a big rush starting Monday of people to want to come in and vaccinate themselves.
Correct. So there are 2 or 3 things. One is healthcare workers are the ones who would be part of the vaccination program. Secondly, they are the ones who would be treating people with COVID. And we don't want that they should really be having a higher chance of getting the infection. Thirdly, and that's why I feel it's very important for healthcare workers to get vaccinated, they're also going to be managing sick patients who don't have COVID. And if you are not vaccinated and you have COVID, and you could have a mild COVID infection, and you go into an ICU, or you're seeing a patient in the outpatient department or in a transplant unit, and you cough or you sneeze, you could be the person giving the infection to your patients. And that itself is unethical and not justified. Therefore, the first priority has to be healthcare workers, to protect your patients, to protect yourself, and to make sure that you are available as the frontline force when we roll out the vaccination program. Also, it's given the country some time to see that this works. you were able to do it smoothly. You know, you could say this was like doing a trial run in a smaller number of people and making sure it works. Now on Monday, it's going to be the final match from that point of view, because the numbers are really going to be huge. And like you said, a large number of people are going to be registering and coming forward to get themselves vaccinated.
Certainly hope so. You know, Dr. Guleria, there's been so much euphoria now. The fact that, you know, this vaccine is it's coming to the public. You saw how the economy, the GDP results were out, finally seeing perhaps a U-turn there in that front. But what we're not, what one seems to be forgetting is COVID-appropriate behavior. One of what wasn't headlined when the government announced that they're going to move into this next phase is the fact that the government has stressed again that we have to enforce COVID-appropriate behavior. We have to ensure surveillance. We have to carry out, you know, testing as usual. Closing word from you to our audience. In the midst of all of this, it is still most important that we continue to wear masks, that we continue to isolate from others, not go out in big numbers. Remember, we have elections coming up in assembly elections a month away.
Correct. So I think it's very important that we understand that we need multiple barriers, and the virus has not gone away. I meet people who tell me that now COVID is over. We have so few cases. But it's important to understand that the virus is still lurking there, and it's looking for an opportunity to really come back. And this is something that we are allowing it to happen. So COVID-appropriate behavior, wearing a mask, physical distancing, washing your hands, avoid crowded places or avoid creating crowds is very, very important. People have started having parties, having big marriages. All of this is actually leading to the virus coming up back in a very big way. Vaccine is one one barrier. But COVID-appropriate behavior is another barrier, and we need to have multiple barriers as we go along this fight against this virus. And we also need to have very aggressive surveillance so that we pick up any variants which happen in our country, and we're able to then develop corrective measures as far as that is concerned.
All right. Thank you, Dr. Guleria, for joining us tonight. Can India become a role model on how to vaccinate 1 billion people at a scale, speed, and a trusted manner? That is the million-dollar question. Thank you, Dr. Guleria, for your time tonight.
Thank you.